So we really need to think when we're talking with our clients, how is it that we can get them to come up with the idea? All right, it's working with them directly. It's getting them to be the instigator, the motivator, the reason that it's all working. So motivational interviewing sort of has a beginning, a middle, and an end. We get our client to really participate in the conversation, to give us that information, to tell us about themselves, and that gives us the rapport that we need with our client. Hello and welcome. Mentoring with Geraldine is a bite-sized practitioner podcast for naturopaths, nutritionists, herbalists, and practitioners. This podcast responds directly to your needs, the needs of the practicing natural therapist. With interviews, herbal discussions, something business and something clinical each week, you'll get the variety you need and enjoy to stay motivated in practice. Welcome to Mentoring with Geraldine and the Bite Size Podcast. How are you today? I wanted to talk to you about motivational interviewing. So it's what we're doing in the Academy this month. So when I say it's what we're doing, that means because we meet 3 times a month, which of course gives you CPE or CPD, depending how you want to refer to it, I give a presentation at least once, and or part of the conversation is presentation. And there's a Q&A. And then once the educational portion, motivational interviewing this month, the webinar is completed, then it's loaded into the Academy vault where everybody can go back and watch and listen to all the Academy education. So there's lots of things in there, everything from setting up your Facebook group, there's education on viruses, it's really about your practice. It's really about your clients creating the environment, doing the other things to get them in. There's all sorts of things in there about, Canva and, there's just so much stuff in there. You do get 7 days free, so you can go and have a look for yourself. But let's talk about motivational interviewing, which is what we're talking about in the Academy this month. And motivational interviewing is when we're talking with our clients, we spend that time with our clients, but instead of us saying, you need to do some exercise, it'd be really good, your back's really sore if you did some yoga. How do you feel about that? And them going, oh yeah, okay, I could give it a go. It's a case of, so you're telling me that you've got back pain. What ways do you see, what system of stretching do you see that might support that? To which they reply, I don't know, I've got no idea. Okay, so let's explore some ideas. So, you could do Alexander technique, you could do yoga, Pilates. There's all, actually at my gym, there's a Pilates class, I could go to that. Great, working on your core. And so as we think of these different, we might have to supply some of the ideas, or they might turn around and go, well, actually, they've got Pilates at my gym. I could try that. Great. That's fantastic. The idea has come from them. And when the idea comes from the client, they're more likely to interact it. Oh, actually, I didn't go to the Pilates class because it's on at 5 o'clock in the evening, but I would do Pilates. Okay, let's explore Pilates and when it could be done to suit you in your time, when you can do things in your time frame. So we really need to think when we're talking with our clients, how is it that we can get them to come up with the idea? All right, it's working with them directly. It's getting them to be the instigator, the motivator, the reason that it's all working. So motivational interviewing sort of has a beginning, a middle, and an end. We get our client to really participate in the conversation, to give us that information, to tell us about themselves, and that gives us the rapport that we need with our client, the understanding, the allowance of time. So if you've been to one of my Finding Your Flow webinars, which there will be another one coming up soon, I haven't set the date yet because I have a new coaching course coming up, and so it will align with that. But so keep your eyes out. Keep following me. But when we, in that hour that we see the person, so I always talk about that first 15 minutes being the client's time and that they get to talk. And then we listen to what they're saying. And then we give it back to them. So we reply, we rejig what they've said. Okay, so I'm trying to use all the different words to the motivational interviewing words because you've probably heard them before. Any basic counselling course, you will have heard all these things before. But it's just the memory, it's just jogging your skill set to be able to go, oh, so you've told me that your mother has died and then the dog died and you fell down the stairs. Have I got that right? Oh, yes, you have. Closed question. So what happened after you fell down the stairs? Open question. So they can carry on talking then. So we want these open questions going in, and we want to recap what they've said. Open questions are super, super important when we're interviewing people so that they keep talking. Yes, of course we have to ask closed questions. How tall are you? How much do you weigh? Of course, what's your blood pressure? These are closed questions, but they're essential questions. But what we want to avoid is tons of those so that the client sits back and becomes complacent. The client says, okay, they're going to do all the work, they're asking all the questions, all the work comes from them, and so the results will come from them as well, which is when we end up producing these huge plans for people, saying they have to do this, that, and the other thing, and then they think, oh, I never need to see her again. I've got my plan here, but they don't do it. When we see our client and we're working on a motivational skill set and we're working through the system and asking them and getting them involved, because all the evidence shows that you need support long term. All right, so we get them involved, as I said, we get them thinking about the changes they can make and how they can support it. So when they come back to us, they're like, yay, I've changed my breakfast and, I did some of my lunches as well, like you suggested. And I've been walking, because I knew I needed to do that exercise. And we talked about walking and we talked about me just walking around the block. And I've actually been walking around 3 blocks. Then it's good on you. You've done so well. You should be proud of yourself. Of course, we should never say, I'm proud of you. That I'm not around all the time. We can't be doing things for others. We need to be doing things for ourselves. We need to teach people to do things for themselves. And to do that, we say to them, you should be proud of yourself. Give yourself a pat on the back for doing that. That's incredible work. It's so hard to achieve that because we really have to acknowledge what they've done before, how difficult things have been, and what's going on for them in their lives. Okay? So we really need to acknowledge them. We need to reply to them, making sure that we have open-ended questions along with telling them what they've already told us. And then we get them on board to be the ones to make those, not only make those changes, but make those decisions about changes, to make those choices about changes, to make the suggestions that we then go on to implement in the plan. Because often, people know what they should be doing. People know that they should be losing weight or they should be helping others or they should be whatever it is to help themselves. But they haven't got the time or they haven't got the skill set to be able to implement it. And that's where we come in. So there's loads more about this in the Academy. I'm not going to go on about it this morning. I just really want to get you to think about it, to get started with those ideas, to think to yourself, yeah, that's a really good idea. I'll look at the timings. I'll look at how I talk to my clients. And one thing I get people to do is to record a consult, so that you can see how many open and closed questions you have, to see, how fluid you are when you're in consult, to see how much, you're telling your client to do things, and to see what you're repeating. So to do that, on your phone, you've got a voice memo. It is on iPhone, and there is something on the Android. I don't know what it's called, but there is one. So you just say to your client, I want to record myself. This is training for myself. I will destroy this or I'll remove this. I won't destroy my phone. I will delete this in 24 hours. Can you just confirm, will you just say yes, that it's okay for me to record the consult, remembering that I am really recording myself, not you. So it's sitting over here by me. So it will pick up some of your replies, but I'm only I'm auditing my own session. I'm auditing how I work. You get them just to say yes. You put the phone down beside you, away from the client, and then you carry on with your consult. And you will pick up all of the nuances and you will pick up all of the things you repeat, because the things you repeat over and over and over again to your clients, they become part of a program. Because if you record yourself all day and for 3 people you repeat one thing and the other 3 people you repeat something different, and yet they all needed to know those 2 different things. So it means people don't miss out. It's not about going, oh, I'm going to do less because I'm recording what I'm doing. It means you're actually going to do more. So I hope you've got some really good tidbits out of this short one today, and I really look forward to supporting you more really, really soon. All the very best. See you soon. Thanks so much for joining me today. Don't forget to rate, review, and subscribe to the podcast for the weekly episodes. If you'd like even more support and learning, then the Academy is for you. Here you'll find part 2 of the herbal discussions, more clinical learning, and case studies to support your clients in practice. Bye for now.